started, I think. Wait, we shouldn't have started now. We should have started. We can't start now. Okay, fine, it's happening. No. Dr. Pradeep? Dr. Pradeep? You can hear us. You can. Dr. Prachet Raghuveer, can you hear us? Dr. Pradeep? Should I put on the chat?
Hello. Hi, this is Dr. Prachet here.
Yes, doctor. We don't have your name in the registration list. So,
Is
uh,
it? Uh,
which
isn't this
session?
supposed to be the poster session? Faculty poster session?
This is not the poster session, sir. This is the paper.
Okay. I'm sorry. Okay, I'm sorry. I'll leave the meeting then.
Okay, thank you, sir.
Yeah. Thank you. Bye.
Bye. Only one participant has come. Yes. We also have to have the presentation. Last time. Yeah, we have to only present, right? Okay. So, we need to work. Dr. Pradeep? Sir, you're not audible. Dr. Pradeep? Sir, you'll have to unmute. Can you put it on the chat? Okay, thank you. Okay, Sridevi. Dr. Sridevi? Dr. Sridevi? Dr. Shri, ma'am, just like to confirm your details. Can you tell out your registration ID? You're not audible. Ma'am, you're not audible, ma'am. Your voice is breaking up. Uh, no, ma'am, it's muffled. We can't hear you properly. Can you please check your internet connection?
Okay.
Hello? Other participants. Dr. Pradeep, can you please unmute so that we can check the sound and the mic? Dr. Pradeep? Dr. Pradeep? Good afternoon, sir. We are just waiting for the other participants to join and then we'll begin. Yes, no problem, sir.
ಹ್ಮ್ ಏನು ಗೊತ್ತಿಲ್ಲ ಸುಮ್ಮನೆ ಒಂದು ಪ್ರೆಸೆಂಟ್ ಅಂತ ಆಗ್ತಾ ಅಷ್ಟೇ.
Dr. Pradeep? Dr. Pradeep? Dr. Pradeep? Can you hear us?
ಹಲೋ ಹಲೋ
Yes, sir. Yes, sir. We can hear you now, sir. Sir, we just want to confirm some details. Hello? Sir, registration ID is RMCKAH 0281 Hello. He's waiting for the second judge to join us. He'll take about 5 to 10 minutes, then we'll begin. Dr. Ramya, ma'am, which session have you signed up for? Because your name is not in our list for this session.
I'm for tomorrow, madam. I just wanted to see how it goes on.
Ma'am, you have to see through the YouTube link. This link is
Okay,
only for the
okay.
participants, ma'am.
Sure, ma'am. Thank you.
Thank you.
Okay.
Your limit is not there.
Dr. Amrita, can you speak so that we can begin? Ma'am, your voice is unclear. Dr. Amrita? Um, we are waiting for a second judge, so please wait for a few minutes, then we'll begin. Um, Dr. Anand, for which session have you signed up? Dr. Anand?
Dr. Devi, can you please unmute?
We just have to do a sound check before we start the event so that there is no further delay. So, Dr. Devi, can you unmute? We just want to check your sound system. Dr. Dr. Amrita, Dr. Pradeep, Dr. Dr. Shashikanta.
Yes, madam. Can you hear me?
Yes, sir. Yes, sir. We can hear you.
Yeah, thank you.
Yes, sir. Thank you, sir. Thank you. Doctor,
Hello.
hello, Dr. Narayan.
Yeah, I am Dr. Narayan Murthy.
Yes, sir. And
Good afternoon. Sorry for the delay.
it's okay, sir.
Uh-huh.
Sir,
Dr. Animesh Jain has come.
yes, sir. Sir is there. Sir, we'd like to verify the list of participants with your list before we begin.
Dr. Sridevi, Dr. Shashikant,
Yes,
Dr.
sir.
Amrita, Dr.
Yes.
Pradeep, and Dr. Chandan.
Yes. Okay. Okay, sir. Just a second.
Okay.
Good afternoon, everyone. Welcome to the 32nd State Level Annual Conference of Karnataka Association of Community Medicine, hosted by Ramaya Medical College. The theme being Redefining Public Health, COVID-19 and Beyond. So today's session is on oral presentation by and for faculty. So with the beginning of the session, we'd like to introduce our judges. So our judges are Dr. Narayan, Professor and Department of Community Medicine from JSS Medical College, Mysore, and Dr. Animesh Jain, Professor of Community Medicine Department from Kasturba Medical College, Mangalore. And we are the moderators
You
for
cannot
today.
connect today.
Silvi and my friend Shreya, we are the moderators for today's session. We are 7th-term students from Ramaya Medical College. So before we begin, we'd like to go over through some rules. So every participant will get 6 plus 2 minutes. So the 2 minutes will be for the question answer session with the judges. And prior to 1 minute of the ending of the 6 minute, that is after 5 minutes, we will be warning you so that you can end your presentation in time. Otherwise, we will have to stop it. So yeah, that's about it. That though, I mean, we'll start now with the session. So our first participant for today is Dr. Sridevi. So ma'am will present your slide and will give you the control so you can take it from there. It's 20129021. Okay. Also, we are very thankful for the judges to take time off from their busy schedule and judge our event. And we are really looking forward to learn a lot from you and for obviously for your valuable inputs. Okay. Sign. Sridevi.
I would like to thank the organizing committee for giving me an opportunity for judging this session. Thank you.
Thank
And
you
all the
so
best to all the presentees.
Dr. Sridevi, ma'am, I've given you the control over the PPT. Dr. Sridevi. Dr. Sridevi. Dr. Sridevi, can you please unmute?
Yeah, I unmuted now. Am I audible?
Yes, ma'am. Ma'am, we'll be starting your time soon. So, could you please start presenting?
Start present. Okay. Not able to see the PPT here.
Uh, Ma'am, can you? She has to present. Ma'am, I've given you the control over the PPT. I've already given her the control. If you give me the control, she has to present.
Is it okay if you present it centrally from there and if she tells you to forward it?
Yes, sir, no problem. We can do that.
If that is okay, because otherwise we'll not be able to move forward. You're already
Okay.
in 16 minutes delayed into the session.
Okay, I think I can start. Good afternoon, everyone. So, as we know, we're all going through a pandemic of COVID-19. I felt it's a necessity of the time to study more about COVID-19. So, this study was taken up with the title Demographic.
Sridhar, have you sent the slides to the host actually so that where they can start the PowerPoint presentation? I think.
I'm sharing this. The control she has to share. I've given her the control. She has to share. Okay, she has to share.
Okay, okay, no
Yeah.
worries.
Okay, I'll start again.
So, this study, the title Demographic and Clinical Profile of Patients with COVID-19 in Urban slums of Bangalore was taken up. Um, so, to begin with the introduction, the World Health Organization reported that the World Health Organization reported more than 62.7 million COVID-19 cases with more than 1.46 million deaths globally, and India contributing to 9.43 million cases of COVID-19 with the 137,000 deaths, of which Karnataka contributes to 883,000 cases and 11,750 deaths as per the data on November 30th, 2020. So I find it is very important to identify the clinical and demographic characteristics of the patients to know the pattern of disease and identify the vulnerable people. So this study was taken up in the urban slums of Bengaluru with an objective to describe the demographic and clinical profile of patients with COVID-19. So the methodology of the study was as follows. This community-based prospective study was conducted in the urban slums of field practice areas of Bangalore Medical College and Research Institute. All the patients who tested positive for COVID-19 right from April whose treatment outcome was declared by the time of 30th November 2020 were included in the study. So each patient was interviewed telephonically by a trained interviewer to collect details on demographic and clinical profiles of the patients. And patients who were not willing to take part in the study were excluded. After in total, we had a 330 patients turning positive between April 2020 to November 30th, 2020, of which we could interview only the 317 patients. The remaining were not, they did not respond or they were not ready to take part in the study, so they were excluded from the study. So our sample size or the number of patients is 370. So when we look at the socio-demographic parameters of the patients in our study, we are them into the age groups like 0 to 20 years, 21 to 40 years, 41 to 60 years, and age more than 60 years. So we had most of our patients in the age group of 21 to 40 years. That is, we had 115 patients coming to around 36.2% of the patients. So I can say that in our study, most of the patients were young patients. And coming to the gender, almost both female and male proportion was equal with 51 and 50.9 among females. And when we look at the socioeconomic status, most of the patients belong to class 3 That is about 35% of the patients belong to the class 3 of VG-PSA classification. Next, the table, next we move on to the table 2, that is clinical profile of patients. So each patient were telephonically interviewed for to know the clinical profile of the patient. On being asked for the history of contact with positive case, so 41.6% of the patients of our study had contact with the positive case of COVID-19. So most of them were the primary contacts and some of them were the secondary contacts. And 58.4% of them did not have any contact with the positive case of COVID-19, but still they turned positive. Then when we look at the clinical presentation, 33.4% of them were asymptomatic and 66.6% of them were symptomatic. So symptoms, they had a symptoms like fever, cold, cough, sore throat, diarrhea, etc. So we included all the a range of symptoms. So all of them who had any of the symptoms were considered symptomatic. And when we look at the associated comorbidities in the patients, 34.7% of the patients in our study had some of the other comorbidities like diabetes mellitus, hypertension, chronic disease. Then they had some they were pregnant or so. Then when coming to the next, 65.3% of them had no comorbidities. So in our study, 34.7% of the people had. When then we into the management of the patients, 50.1% of them had undertaken home isolation and they
Ma'am,
recovered
you have
well.
1 minute left.
Hello? Yeah?
You have 1 minute left.
Okay. Then we 49.9% of them required hospital admissions. So of which they were admitted to the COVID designated hospitals and also the COVID care centers. Then next we look into the treatment outcome. 95% of our patients recovered well and they were discharged from the hospitals and from the home isolation, and 1% of them succumbed to death even after the intensive treatment given to them in ICUs. So the death rate was 4.1. So the trend of COVID-19 is as follows in our PHC. Like in April, we had very less cases, and the peak was in the August. In August, we had a total of 190 patients, and later it has come down in September. Again, there was a peak, little increase in October, and again there was decrease in November. Right now, we had only 5 cases in November.
Dr. Sridevi? Dr. Sridevi, your time
Yeah.
is up, ma'am. Can you please stop?
Yeah. Can I finish this slide, please? Only one slide left.
Ma'am,
Trend of COVID-19.
we've been
The
instructed.
peak of deaths was in June. Even in spite of less cases, in June we had more number of deaths. Afterwards, there was a steady manner maintained the number of deaths.
Okay.
Majority of the patients were young and asymptomatic, and patients with comorbid conditions were vulnerable to complications. Thank you.
Dr. Animesh Jain and Dr. Narayan Murthy, sir, you're welcome to ask the question and answers for Dr. Sridevi. You have 2 minutes, sir.
Yeah, so Dr. Sridevi, thank you for presenting. I just wanted to ask you 2 things out of curiosity. Why only slum dwellers? Why did you choose only slum dwellers? You said that you wanted to know about, the demographic distribution and all. That's one. The other thing is, how many of them were children in your distribution of these patients?
Sir, actually, we took, the second question I'm answering. We took like 0 to 20 years, sir. In that we have again we have not exact number how many of them children, but we had 45 cases of cases coming in the age group of 0 to 20 years, sir. But this and the first question I would like to answer, that is why we took in slums, and that is because we have a USDC attached to the BMC is Sudhamnagar UHTC, and most of the area covered by that UHTC is slums. So I took up that title of slum dwellers, and in the beginning, the spreading of COVID-19 was very faster in the slum areas because of the congregate settings and very low socioeconomic status. So I thought like it would be nice to have more look into the slum dwellers. Thank you, sir.
Okay.
Okay, it was nice presentation, Dr. Sridevi. Just I would like to know about you said only the symptomatic and asymptomatic. What are the symptoms, how they are presented? That also one slide would have put, I think.
It's actually symptomatic. In symptomatics, we included all range of symptoms, like starting from fever, or just common cold, cough,
Yeah, there
or
only just
diarrhea.
the frequency. Actually, I wanted to know about the frequencies. So that's why I asked. Even the comorbidity also, what were the comorbidities? Majority were having like diabetes, hypertension.
It's diabetes and hypertension was the most of them had diabetes actually, and next comes the hypertension, and some of them they were having chronic obstructive lung diseases.
Okay, thank you.
Thank you.
In your conclusion, you have said symptomatic or asymptomatic more. I thought I saw it the other way.
Sir, asymptomatic young patients were asymptomatic actually.
Okay, thank you.
Thank you, sir.
Dr. Sridevi and judges for your valuable input. Can I ask Dr. Shashikanta SK to present next?
Yes,
Dr.
yes,
Shashikanta.
yes. Can you hear me?
Sir, you have 6 minutes for your presentation.
Yes, yes. Can you all hear my voice clearly?
Yes, sir.
Yes. Good afternoon, Narayan Murthy sir, and Dr. Animesh sir, and my dear colleagues and the moderators from Ramaya College. And can I share my PPT?
So you should be able to share your PPT now.
Yeah, just can you all see the screen? See the screen which I have shared?
Yes, sir, your
Yes.
PPT is visible. Can we
Yes.
start the time, sir?
Yes, sir. Please. Yes, ma'am. Please. So this was a study. This was an observational study done in the field practice area of our Adishchan Giri Institute of Medical Sciences with the title "Far from Over: The COVID-19 Response and Adaptation." It's a cross-sectional study in rural area of southern Karnataka. And coming to the introduction part, as we all know, COVID-19 pandemic has shattered the lives of lakhs of people as well as in the whole world. Not many are spared by this disease, this pandemic. And the infection has already killed lakhs of people. And the vulnerable population may include older adults and people living in densely populated areas and those who are in lower socioeconomic status and migrants as well as minorities. So alongside the direct effects of the disease on health and mortality, widespread social and economic disruptions will have far-reaching impacts on human well-being. So this was a study undertaken to see the immediate response and adaptation of the rural people in the field practice area to COVID-19 pandemic, because not just the disease mortality which is causing them the problem, it is also the other problems with respect to the socio-economic adaptation and the other things which I'm going to make a mention. So, as I said, the rural areas of developing countries are also at increased risk of being affected by the pandemic, and the immediate responses owing to underdeveloped health infrastructure and uneven state capacity for infection control and endemic poverty needs to be studied. So, the study was undertaken with the objective of estimating the COVID-19 awareness in the field practice area and with special emphasis on economic adaptation and health problems faced by the rural community due to COVID-19. So this was a cross-sectional study conducted in the month of September on 954 randomly selected subjects. The study area was selected by our convenience and feasibility, but in the study area we selected the 954 individuals randomly based on the common sample size formula used, 4PQ by L square, calculated based on a pilot study done on 2 different villages, wherein we saw at least 2/3 of the respondents had some knowledge about COVID-19. So the sample size which we got was somewhere around 850. So we have also taken additional samples, and that comes out to be 954. And a pre-tested interview schedule was used to estimate the awareness, and relevant inferential statistics were also given. So coming to the results proper, the mean age of the participants, it was 49.61 years with a standard deviation of 13.35 years. And nearly 90% of the respondents mentioned COVID-19 as a major disease affecting people. So before we go to the results proper, few other demographic characteristics, like in our study, nearly 30% of the participants, they were illiterate, and 60% of them were practicing agriculture, and nearly 30% of the families which were interviewed had kids less than 10 years of age, and nearly 30% of them had studied up to PUC. So going on to the next important result, that is 80% of the participants, they felt COVID as posing a major threat to human life, and 80% of them felt that coughing by an infected person as the major route of spread. And more than 1/3 of the respondents mentioned combination of hand washing, isolation, social distance, mask usage, as well as vaccine can prevent the spread of COVID-19. So as per the subjects, 2 out of 10 COVID infected patient will die. And the mean family income, which we saw in the study sample which we had selected, in the pre-COVID phase, it was 15,354 rupees, whereas in the COVID phase, the mean family income was 11,200 rupees. And 1/3 of the respondents had to visit a health center for nearby for one or the other health related issues. And to add on to this, and out of the 1/3 respondents who felt the need to visit the health center, majority of them, 60% of them, visited the government health center, wherein the 20% of those 60% who visited the health center, they had to face few of the difficulties like non-availability of the doctor. Yes. Is there
Sir,
something?
you have 1 minute left.
Yes, thank you. So as I mentioned, one of the main objective was to see the economic adaptation, and wherein we saw the COVID period had dented their income to a greater extent, with 11,200 rupees of mean income per month family income. And if we, when we saw the inferential statistics, and those who were a bit educated, like those who had completed second PUC and above, their adjusted odds ratio was far better in terms of the prevention of COVID aspects that should be known to everyone, like isolation, social distance, and mask usage, including vaccines and all. And also a few of the other parameters like knowledge about Arogya Setu and the information about the COVID-19 disease in the various helpline numbers that were given were also included. As such, we included more than 30 questions, and few of the major findings are being shown here, sir. So in
Sir, your
conclusion,
time is
yes, in conclusion, adverse health and economic impact of the pandemic could be clearly seen in the study population, which warrants long-term collective corrective measures. from the individual as well as the government, because it is the individual community as well as the local village representatives who can come to the immediate rescue of the people in this times of crisis, and additional studies needs to be carried out in with the similar objective. Thank you, sir. These are all few of the references. Yeah, thank you, sir.
Thank you, Dr. Shashikant. It was a good presentation.
Thank you,
Just
sir.
I would like to know about any relation with the literacy status and the response.
Yes, sir. Yes, sir. Sir, as I mentioned, sir, with the every. Sir, can I? Hello.
Continue.
Yes, sir. Sir, with the every unit increase in the education level, for example, I have taken till 5th standard and till 9th standard, 10th completed and 2nd PUC and above. So those people who were educated till 2nd PUC and above, in them the adjusted odds ratio which we found was somewhere around 4, sir. And even the confidence interval of the adjusted odds ratio was showing a positive trend. So as they get better education, means as they were educated, the COVID-19 preventive protocols that has to be practiced were better known to them. And even in few of the people who were who had completed degree and above, they even had a better knowledge about the COVID-19 pandemic and the long-term adaptation that they have to do during this crisis, sir.
Okay, thank you.
Did you check for any of these having themselves had COVID, or maybe any of their
Yes,
near
sir.
and dear ones had COVID?
Yes, sir.
Any
Yes, sir.
of those people had COVID, and how did that affect them? That's one. The
Yes,
other
sir.
thing, did this study protocol go through the ethics committee of the institution? I didn't see any mention of that in your methodology.
Yes, sir. Yes, sir. It did go through the ethics committee review, sir. And only after that, yes, there is not a mention of that. I'm sorry. And it did go through the process. And in the study sample which we collected, 956, we found 80 of the participants or one of the member in their family had COVID positive disease. And for them, 60% of them were quite satisfied with the kind of treatment the government has given, and remaining 40% felt that immediate response after they rang the helpline number or contacted the immediate health facility, they were unhappy. So 60% of the 80 people who contacted the disease in the families which we visited, they were quite happy.
Thank you.
Thank you, sir.
Dr. Amrita?
Hello?
Dr. Amrita?
Yeah,
Yes,
can you hear
ma'am.
me?
Can you please share your screen?
Yeah, sure.
Screen, ma'am, not only the presentation, you have to share the entire screen.
Yeah, sure. I'm not able to share the content today. Okay.
Ma'am, your screen is visible. Can I start the timer?
Yeah, you can just start.
Ma'am, are you sharing the entire screen?
Yeah, I am. You're not able to see it?
Yes, ma'am, we are able to see. I'll start the timer, ma'am.
Okay. Yeah, so good afternoon, everyone. Good afternoon, all the judges and all my fellow colleagues who are doing the presentation. So today I'm presenting on the psychological impact and stresses of being quarantined following exposure to COVID-19, a mixed methods study. So as we all know that coronavirus is a dreaded disease which has been, it is a pandemic now. And as currently there is no effective pharmacological intervention or vaccines which are still available to treat or to prevent COVID-19. So for this, all the non-pharmacological public health measures like isolation, social distancing, and quarantine are the only effective ways to respond to the outbreak. So, and as in our country, there are very few mixed method studies which are done on the quarantine people. So, it is done, the study is done to explore the various stresses and also to examine the psychological impact in the quarantine people following exposure to COVID-19. The objectives were to assess the psychological impact of being quarantined following exposure to COVID-19, to understand the various stresses of being quarantined. So the study was conducted in a medical college of Bangalore, and it was for 2 months. And type of study, it is a two-phase explanatory mixed method study. In phase 1, the quantitative data was collected. Phase 2, the qualitative data was collected with the help of in-depth interview of people who were quarantined in the medical college institution. So people quarantined in the quarantine wards of medical colleges were taken, and a total of 107 people were quarantined. And in-depth interview was taken till the data saturation was obtained, and a total of 15 people were interviewed, out of which 8 people were females and 7 were males. Inclusion criteria is of people who were quarantined either following history of contact with COVID patient or because of the recent travel, and who were quarantined only at the institution and who gave consent. And institutional ethical clearance was taken before starting the study. And in phase 1, the basic